So this is part 2 lecture on the blood supply of the brain. This is very important lecture, so please stay with me. You can see here that this is your complete the frontal lobe here. So this is a portion of the anterior cranial fossa, this one. Let me please highlight this. You can see this is anterior cranial fossa, and then this is your middle cranial fossa here, parietal and temporal lobe. So this is the territory of posterior cranial fossa. That in posterior cranial fossa, if you remember that you have got foramen magnum. This is medulla, which continues as spinal cord and exit through this foramen magnum, and then cerebellum. Then you have got pons. Then above midbrain. So this complete portion of the brainstem and hindbrain, it basically present in your posterior cranial fossa. These two lobes, parietal, temporal, and middle cranial fossa, and this is territory of the anterior cranial fossa. We have to understand first that in this is a view. So you are viewing like this. This is a ventral or the anterior inferior view of the brain. So what are the arteries which supplying blood to this part and this part? This is very important. So let me please show you another picture first. Then we will draw the blood vessels. So here you can see. This is as it's mentioned here that this is anterior view. Yes, brainstem anterior view. Yes, brainstem. This is structure of the nater atlas. This is property of the nater atlas. So this is brainstem anterior view. You can see the best book for the structures is the nater atlas. So do stick with the nater atlas, please, when you are in first grade of MBBS. So please, this is your medulla, this is pons, and this is your midbrain. So look, please. This part of the brain, medulla, from medulla we are having basically last 4 cranial nerves. This part is the pyramid and this is olive. So between pyramid and olive, you can see this is your 12th cranial nerve, which is a hypoglossal nerve, which innervates to your tongue muscles. So this cranial nerve originates between pyramid and olive, and 3 cranial nerves, glossopharyngeal, vagus, and the hypoglossal, these are originating lateral to olive. And then at the level of the pontomedullary junction, at the medial side you have got abducens nerve, and on the lateral side here you have got your trigeminal nerve. Here you have got facial nerve also. Here you have got vestibulocochlear, which is receiving the sense of the hearing. And from the midbrain you have got 2 important nerve. You have got oculomotor nerve, third, and then you have got trochlear nerve also, which is your 4th cranial nerve. So this is the significance of the brainstem, that almost 10 cranial nerve originate from the brainstem. Now guys, this is important to understand, okay, that which arteries supply to the medial side of the medulla, which arteries supply to the lateral side of the medulla. So look, let me please draw here. Look, so this is the medial side of the medulla, yes. So medial side of the medulla, and this is the lateral side of the medulla. So we are having 2 important arteries which supply to complete central nervous system. One is the vertebral artery. Second is the internal carotid artery, and we know that vertebral artery is coming from the first part of the subclavian artery. It enters into your brain, it enters into your skull through the foramen magnum, and from the anterior side you have got 2 internal carotid arteries which enter into your brain through foramen lacerums. So these 2 arteries are very important, because up to the midbrain you are having blood supply from internal carotid artery. Complete brainstem including your spinal cord, it's receiving the blood through the vertebral arteries. So these 2 arteries are very important. So look, this is suppose your right vertebral artery here, and this is a left vertebral artery. So left vertebral artery and then right vertebral artery. Both these arteries give a branch which is called as anterior spinal artery. Anterior spinal artery. So this is anterior spinal artery. Anterior spinal artery. Yes, anterior spinal artery. In first part of this lecture in blood supply of the brain, I have completely drawn the circle of Willis. So if you have not completed that lecture, you must watch first the blood supply of the brain, the circle of Willis, and then you should watch this lecture, because that is very helpful to understand complete circle of Willis. Here look, this is right vertebral artery, left vertebral artery, and vertebral artery giving first anterior spinal artery. So anterior spinal artery is supplying to the medial side of the medulla, and then both these arteries, they will ascend and then they continue as basilar artery. So basilar artery, as you can see, it's sitting on the medial side of the pons, and then it's giving lot of branches on the lateral side like pontine arteries, and then it's also giving anterior and inferior cerebellar artery, which is called as Ika artery, pontine arteries, labyrinthine arteries, and then this vertebral artery also give another artery which is called as pica artery, which is supplied to the cerebellum, posterior inferior cerebellar artery. So it means that blood supply of the cerebellum, and blood supply of the medulla, blood supply of the pons, it's basically derived from vertebral artery and basilar artery. And then basilar artery, here it's giving another artery which is called as PCA artery, posterior cerebral artery, which supply blood to your midbrain. Now what is the most important thing, guys? Look, if there is blockage, if there is a stroke, if one patient is having ischemic stroke, and if there is a stroke of the anterior spinal artery, it means there will be problem with the 12th cranial nerve, hypoglossal nerve, which help in the movement of the tongue. All the motor function of the tongue, all the muscles of the tongue are innervated by hypoglossal nerve, except the platoglossus, which is innervated by 10th cranial nerve. Now suppose one patient is having stroke of this anterior spinal artery, it means there will be injury to first medial side of the medulla. Medial side of the medulla injury, it means there is injury of the hypoglossal nerve. So medial medullary syndrome, it's blockage of the anterior spinal artery. Lateral medullary syndrome, it means 3 cranial nerves, 9th, 10th and 11th. Their function will be gone, function will be impaired. So that is called as lateral medullary syndrome in case of the blockage of the pica artery. And in case of the basilar artery stroke, first nerve to be damaged, that is the abducens nerve, injury to the lateral rectus, because lateral rectus is innervated by abducens nerve. Problem with the Ika artery, because it's supplied to the lateral side of the pons, it means you will have problem with the trigeminal nerve, sensations of the face, including the mastication also problem, and then problem with the hearing and facial palsy. It means you are having problem with the Ika artery because it's supplied to the lateral side of the pons, and these nerves originate from the lateral side of the pons. Problem with the PCA artery, which supply to the midbrain, and we know that 2 cranial nerves originate from the midbrain, 3rd and 4th oculomotor and trochlear. Oculomotor, which almost supply all muscles of the eyeball, extraocular muscles except your superior oblique muscle and except the lateral rectus. It means stroke of PCA artery patient is having ophthalmoplegia, and in addition this PCA artery, as I have told, it supply to the midbrain, so oculomotor nerve also help in constriction of the pupil. So pupil dilated with ophthalmoplegia, where does this stroke lies? It's a stroke of the PCA artery. So this is the significance, guys. You have to understand at any cost that all these blood vessels, what are the cranial nerves originating, what are the tracts passing upward or downward through this brainstem, and which arteries supply to this part. This is the significance. And then on complete upper portion of the brain, there is anterior cerebral artery, which is a branch of internal carotid artery, middle cerebral artery, and then posterior cerebral artery. I have already mentioned that this is a branch of basilar artery. So MCA artery, it's supplied to basically your temporal parietal lobe, and you have got lot of important areas like you have got speech areas, you have got auditory areas. So this is significance, that until unless you will not understand the function of these parts of the brain, the function of the cranial nerves, and then which arteries supply to this part of the brain, you will simply not be able to diagnose the person who is suffering from the stroke. And again I am insisting you have to draw the circle of Willis and another structure. Okay, let me show you another structure to make your concepts more clear. Guys, focus here please. Look, this is the brainstem blood supply. Yes, brainstem blood supply. Here you can see. So this is the medial side, guys. This is the lateral side, and this is your midbrain, pons and medulla. Midbrain, pons and medulla. In midbrain, I have told you have got PCA artery. So midbrain territory is basically receiving blood through the posterior cerebral artery, which is a branch of basilar artery. Okay, 3rd cranial nerve and 4th cranial nerve. Both these are originating from the midbrain. And then from pons, I have told you from medial side, which artery supply to the medial side of the pons. If I will ask you, you will answer me the basilar artery. If basilar artery stroke, which cranial nerve first will be affected? 6th cranial nerve, abducens nerve. Why? Because it's originate medial side of the pons. Yes, you are very smart, you understood. Yes. And then on the lateral side of the pons, look, which artery supply on the lateral side of the pons? Ika, anterior and inferior cerebellar artery, trigeminal, facial, vestibulocochlear. Stroke of the ICA, all three gone. Yes, yes. And then medulla, medial side of the medulla, anterior spinal artery. Stroke, first kind of to be injured in case of the anterior spinal artery stroke, that is hypoglossal nerve. Yes, medial medullary syndrome. Pica stroke, posterior inferior cerebellar artery stroke, it's mean 9th, 10th and 11th nerve. So this is the significance, this is the worth. Another important thing that you have to understand here, that anterior spinal artery in addition also supply to your spinal cord. Almost 2/3 of the ventral portion of the spinal cord is receiving blood supply from anterior spinal artery, except your dorsal column. So guys, remember, whenever someone is asking you what is the blood supply of the spinal cord, just mention two arteries, anterior spinal artery and the posterior spinal arteries. Anterior spinal arteries supply to the ventral 2/3 of the spinal cord. Okay, here, ventral 2/3. So anterior spinal artery supply to ventral 2/3. So this complete portion is receiving blood from anterior spinal artery, which is a branch of vertebral artery, and this dorsal column or the posterior column is receiving blood through posterior spinal arteries. So posterior spinal arteries are branches of Pike artery. Posterior spinal arteries are paired in number. You can see paired in number, two arteries. Yes, posterior spinal arteries are paired in number, are branches of the Pike artery. Anterior spinal arteries are branches of vertebral artery. Here you can see vertebral artery branch. So it's single in number. Anterior spinal arteries supply to the anterior 2/3 of the spinal cord. Posterior spinal arteries are supplying to posterior spinal arteries are supplying to the dorsal column. Yes, posterior spinal arteries are supplying to the dorsal column, to this part of the spinal cord. So what are the two important arteries which supply blood to the entire spinal cord? Number one, anterior spinal arteries and the posterior spinal arteries. Anterior spinal arteries are the branches of vertebral artery. Posterior spinal arteries are branches of the Pike artery, and Pike arteries are the branches of the vertebral artery. So what is the most important artery which supply to the nervous system, central nervous system, especially to the brain stem and spinal cord? Answer, subclavian artery branch, vertebral artery. Yes. So remember guys, both anterior spinal artery and posterior spinal artery, they are interlinked. They are having special anastomosis by this segmental artery. Here you can see this segmental artery. So segmental artery is connecting basically both anterior and posterior spinal artery, and largest segmental artery is the artery of the Adam Keyes. Adam Keyes was one Polish scientist. So by his name, by his work, we are entitled, we have entitled this artery as the artery of the Adam Keyes, which is largest segmental artery. So remember guys, anterior spinal artery and posterior spinal artery are connected, or they are anastomosing each other by segmental artery, and spinal cord as it's sitting in the midline. So major blood supply of the spinal cord is coming from anterior spinal artery, posterior spinal artery, and what are the other branches to some extent which supply to the spinal cord also. So as it's in midline, so intercostal arteries, which intercostal? Posterior intercostal arteries. It also receiving blood to the lumbar arteries also, lateral sacral arteries also, which are branches of the internal iliac artery, ascending cervical arteries, which are also branches of subclavian arteries. So in short, if I will ask you what is the blood supply of the spinal cord, anterior spinal artery, posterior spinal artery, this is 95%. Rest 5% is coming from other branches which are supplying to the midline, and they are also supplying blood to spinal cord. Posterior intercostal arteries, ascending cervical arteries, lateral sacral arteries, and lumbar arteries. Anything else? Okay, let me check. No, this is it. Thank you for your concentration. See you soon. Thank you.